If you suffer from claustrophobia, you're probably looking at ways to try and solve the problem. And one of the ways is through hypnosis. Now, does it work? Well, I'll explain all about hypnosis, how it can help you with claustrophobia and what it can and can't do. So, first of all, what is claustrophobia? Well, if you go to the dictionary definition, it basically means an extreme or irrational fear of being in a confined space. Okay, it's a phobia which affects about 5 to 10% of the population, but in the majority of the cases, people tend to live with the problem rather than seek help for it. And they do that because most of the time they can use avoidance tactics. The problem is the more the avoidance tactics you use, the bigger the problem can get. And so the problem gets worse over time. So how can hypnosis or clinical hypnosis help cure the problem and help you to sort of move forward with your life? Now, I gave you a simple definition earlier, but actually claustrophobia encompasses two fears. One is a fear of being restricted, and the other can also relate to being suffocated. And both of these problems are a form of anxiety, and as such, they create symptoms such as a racing heartbeat, dizziness, sweating, nausea, panic, and problems with breathing, which can obviously cause real issues in your life. What claustrophobics worry about is being unable to escape from a situation. And it is worth mentioning claustrophobia being a fear of being trapped. Okay, so when people think of claustrophobia or indeed kleptophobia, they think of situations such as potholing, being stuck in a tunnel, but there are other things that can trigger it as well. And they include being in an aeroplane, getting into a lift, using an MRI machine, going into cupboards, going to the toilet and locking the door, dressing rooms in shops, going on the tube, especially in London, and if you're, on an underground station elsewhere in the world, that can be an issue as well. Trains, being in rooms that don't have windows, and since COVID, wearing a face mask. Now, some of these things are easy to avoid, but others aren't. So, for example, when I was in London, most of the capital gets around by using the underground system. If you want to get on a bus, it's slow, okay? And due to the size of London, you can't necessarily walk everywhere you want to go. Yet clients who worry about being in confined spaces would take the slower routes time and time again to avoid triggering their fear. And in fact, many of my clients spent years with this problem before seeking help with clinical hypnosis for claustrophobia because of their past avoidance tactics. It's usually only when they start to suffer panic attacks or need to undergo a medical procedure that they finally choose to seek help to overcome it. And that means they can't avoid the problem anymore. Now, the closest phobia to being the opposite of claustrophobia is agoraphobia, which is traditionally thought of as an irrational fear of open spaces. However, the dictionary describes it as an extreme or irrational fear of entering open or crowded places, of leaving one's home, or of being in places from which escape is difficult. So again, this can have a profound effect on your life. Even though claustrophobia phobias involve being in confined spaces and being like restricted or suffocated, agoraphobia can trigger similar feelings of anxiety. So an example of this may be a person who worries about attending large outdoor music events. A claustrophobic might worry about being crushed by the crowd, while an agoraphobic might panic about being unable to escape to a place where a crowd is not around them. As you can see, the fears and phobias do tend to have overlaps, or they're related in some way. They can be incredibly similar, and anything can sort of trigger these fears. So hypnosis claustrophobia sessions are designed to help people overcome the problem, not just through general suggestion and relaxation, but discovering what the related triggers are and then retraining your subconscious mind to think differently so that the thought processes behind all of this can be changed. Now, the traditional treatment to overcome claustrophobia or related issues is exposure therapy. Now, this is a form of help where patients are gradually exposed to the problem that they fear, so eventually the anxiety reduces. Now, the key to making exposure sessions work is to help slowly introduce that person to whatever is causing the problem and then slowly getting them more and more familiar with it until it becomes second nature. Now, if we imagine someone who might have a fear of being stuck in a toilet cubicle, so we might start by helping the person start to stand outside the cubicle with the door open. Maybe they build up their confidence and you use some hypnosis on them and get them feeling calmer, and then shut the door on them while they're, in that cubicle, but you're stood outside. You only do that for a second. And then you slowly build up their tolerance to that door being shut, and then finally you lock it when they're ready to, and so on and so forth until they feel pretty confident they can do it on themselves. Now that sounds like a good idea, but the problem is that exposure therapy isn't always as easy as it sounds, okay? What if the hypnotherapy client is so anxious they simply refuse to go near the cubicle in the first place? What if someone's having a panic attack while you're trying to do this with them and they start freaking out? What if you think you're resolving the right problem in hypnosis, but in fact the issues are subtly different or aren't actually related to the toilet cubicle at all? We already know that these fears and phobias can be closely connected, so it can be easier for a hypnotherapist and for your client to get the wrong end of the stick when conducting hypnotherapy and go off on the wrong route. So you sometimes need hypnosis as an add-on to do a little bit of extra work for you. So what can hypnotherapy for claustrophobia do that's different from the traditional exposure treatment? Well, hypnosis for claustrophobia is a great alternative form of therapy to help with fears and phobias because it works in a number of different ways to address fears. Number one, it's deeply relaxing. And when you're more relaxed and calm, the anxiety response that you feel is reduced. Okay, so that makes it easier to get a person to start to face their fears. Instead of being a 10 out of 10 on the fear scale, maybe they're only a 6 or a 7, and that's enough for you to be able to start working with them. Secondly, we use things like positive affirmations, visualizations, and mental rehearsal in hypnosis to reduce the severity of the fear and to help our clients feel more relaxed. We're going into the subconscious part of the mind and introducing the idea of doing things differently, and that can also help. But thirdly, and my favorite, is analytical hypnosis, which is discovering the subconscious root cause of the problem. When you get someone into a really deep state of trance, it's possible with a trained hypnotherapist, a good one, to start asking questions to find out what's happened to that person to cause the issue. It pops up into their mind over a series of sessions, so you can start to understand what the triggers of the problem were. When you know that, you can aim hypnosis at that actual problem and get them to re-rationalize the situation. And that can make a huge difference to how our clients feel and change the way they think. In fact, I often call it the light bulb moment, when the client realizes what incident it was from the past that causes their problem. And when they rationalize it and don't have the fear so much in the present day, the two parts of the mind combine and they create a change, a shift. And sometimes that shift happens in the session. It almost feels like you're switching a light switch on or off. Literally, the light switch goes on and that person's fear instantly drops. And when you've got that moment, you can really move them over the line and getting them to do things that they previously wouldn't have done before. Relaxation, positive suggestions all work. However, when you understand why you have a problem, it can be crucial to changing how your fear is triggered. Analytical hypnosis can help a client go back through those subconscious memories to discover the real reason why they might have a problem. And when you have that awareness, it changes things. So my clients have found out that they've had problems with claustrophobia because, I don't know, they were locked in a dark room as a punishment when they were a child and it used to make them scared. Or they were accidentally trapped in a room, cupboard, vehicle, or whatever it was, and they couldn't get out, and that scared them. One of my clients was trapped in the drawer under a bed when it broke and when her and her brother were playing in it. One of my clients had the experience of not being able to breathe when their sibling was fighting with them and put a cushion over their mouth. Another one had a near drowning incident as a child, and sometimes I see claustrophobia triggered as well by people who've had asthma attacks. So here are some of the typical examples that our clients may never have thought have got anything to do with their fear. But when they understand it and rationalize that those things aren't happening to them now and can't happen again, it changes it and the fear starts to drop. Now, in most cases, having claustrophobia is not life-threatening, which is why so many people with the problem fail to seek treatment for years. However, in some cases, it is absolutely essential that someone gets urgent treatment to overcome claustrophobia as quickly as possible, and that's when a medical emergency is present. Now, I've had a number of these. Many people finally seek out my help when they have something important like an MRI or require radiation therapy for cancer. Now, most MRIs are enclosed, which means that for doctors to see a patient's results, they need to be able to lie in that machine that sort of resembles a tunnel for around half an hour. And some people just can't face that procedure. And in fact, there is a panic button in an MRI machine for people to come out of it because it's triggered that fear so often. So hypnotherapy can help people to be more comfortable with the procedure and potentially enable them to get the medical results they need. Radiation therapy takes things a little further, especially for head and neck cancers, which require targeted radiation to be aimed at a tumour. In order to make sure they get the right area and it's precise, the patient has to wear a mask over their face that restricts their movement. This is a safety feature so that you're not getting the radiation in the wrong area. But of course, some people find this claustrophobic. As many patients who've had cancer therapy may already be feeling really anxious, that mask amplifies that fear or phobia even more. So claustrophobia hypnosis is really, really important to overcome the issue. Um, Obviously, we've just gone through claustrophobia with COVID as well. People wearing face masks really caused a problem for some issues, for people just getting into planes or being in hospitals. And a lot of people would do anything they could not to wear that mask. So you can start to see that claustrophobia can hit you in all walks of life and be triggered. And sometimes you can't avoid it. We couldn't when the COVID was around, certainly not initially. And as you said, if you need a medical treatment, you need that medical treatment. Your choice is if you don't go through with that medical treatment, you could die. And that's really important for you to seek help. Obviously, you can seek help by contacting someone like myself and having one-to-one sessions. I tend to do them online. Or alternatively, you can use something like my online anxiety course and downloads at home to train yourself to be calmer and more relaxed. My downloads are designed to be deeply relaxing, to help reduce that anxiety response and to give those positive suggestions and affirmations you need. And my anxiety course goes through techniques with you to help you calm the anxiety response as well. And you can find that on my website. Head over to rewirethemind.com for more information. Download my self-hypnosis audios, use my worksheets, try my anxiety course, and read on my blog as well to create positive change, mindset changes, and also improve your well-being.